Hello, everyone. Welcome back to the Practice Perfect podcast. Today's episode is going to be exciting. I am here with my amazing co-host, Maya Turner. Welcome to the show, Maya.
Hello, everybody.
And of course, I am Jennifer McNamara, your host. As always, we love doing this podcast. I think we've been together so long. I don't even know if I could do a podcast without you, Maya. I don't even know
I
if we could even make
know.
that
It's just
happen.
like it's so natural. It's like, you know, it's almost, addicting because you have that, conversation that you want to have with others and you know that people are listening and,
Yeah,
really adding on to your thoughts. So this is just an amazing opportunity to just talk shop.
that's what we do, right?
Yes.
Well, and sometimes I think we love what we do so much that it spills over into our conversations, and our husbands are like, "Can you just not talk about work?" Like, but it's like we love it, so it's naturally going to be part of our conversations, right?
Oh my God, I wasn't ready.
Strap in, girl. So,
Okay.
today, guys, I know this topic is going to be a little bit controversial, but I want to assure all of you out there, we are not ragging on anybody. We are not trying to say that third party organizations are not valuable because they're so valuable. Healthcare
Absolutely.
Inspired LLC is a third party organization. We are not saying that. But we want to be very clear and intentional with this episode that accountability, compliance, if you're going to use a third party organization, understand the boomerang effect, right? Third party billing boomerang. Sometimes the suggested or the intended savings swings back.
Yes. I also think that it's about how third party cost saving up front may not be as much cost saving based upon the errors and the lack of compliance, because the compliance piece that's related to third party billing is also an OIG requirement. And if they don't have that, then that's going to really swing back at you big time.
100%. It's just what we realize happens, right? So, I mean, think about, for instance, what we were able to accomplish for Fox Valley that we did the
Yes.
white paper on. The white paper is out there, guys. If you want to actually learn more about what we have done for this amazing organization, you can go to the site here and you can pull that white paper and read about it. Our amazing friends over at Fox Valley Medical Associates in Aurora, Illinois, great people over there. We did some great things for them, talking about taking them from a negative 7% margin to a positive 13 in six
Yeah, that
months. Like,
Yeah, and yeah, that's pretty phenomenal. And it all goes back to education, right? Compliance and being collaborative in the efforts. One has to receive, right, and someone has to hear, right, and provide that information. So I think it's really important from all regards that when you seek consultants or third party, there has to be collaborative efforts to make it better. It just can't be one-sided.
100%. Now, mind you, nothing against my technology people out there, but we did all of this without AI.
Sure did.
We did it with what's in here.
Yep.
And of course, regulatory guidance that we have years of experience in. So don't knock the experience of consultants and coders and billers out there that you have right in your organization. I think a lot of times organizations are not utilizing their staff that are certified. They have experience in areas that your CFO does not have a lot of the
Mm,
time. And so you're
yeah.
going to people trying to have them fix things, but the people that can help you fix things are right in that chair in your coding department, and utilize them. And we're going to talk about that in a future episode as well. But that's just something I want to bring up, that, sometimes you think you have to go outsource things when all you really have to do is train the people that are already there being loyal to you.
Absolutely, and we've seen that to with Midwest Referral, one of our newer clients, where they're promoting within, giving her the sources and the training that they need in order to provide a better outcome by someone who is looking, who is willing, and they are willing to provide her the sources that she needs in order to be successful.
Right. So let's start with the basics, guys. Why do practices outsource? What is the reason? What do you think? We know a lot of the reasons, Maya, but let's hit some of the highlights. What are some of the reasons?
Time, staffing, expertise, and they don't have the internal resources. And I think that's the biggest point, is that when they don't have the resources, they've got to find somebody who is, and who is an expert and has been proven successful at being that expert.
Mm-hmm.
Yeah.
Exactly. So, I mean, they need those resources and they sometimes don't know where to get them. They think, well, you know, if I outsource, I'm going to save money, I'm going to save time, claims will get out faster, it'll take the stress off of my team so they can focus on other tasks, which is a great, and it's a great reason to do it, because there are things that if your internal staff, if they can focus on, really focus on the patients, make your organization really successful and a place people will feel comfortable going to, and they want to come, and the business side can be taken care of by those who have the experience. But there's also the caveat of, does it really do that? In some cases, yes, it does, if you choose the right third-party organization. But there's not just handing it off and saying, see you later, hope it goes well, where's my money? There's a lot more to it than that. Once you throw it out there, if you don't track it, things, well, like we said, they boomerang, they come
Yeah.
back.
And it's interesting about the boomerang, right? How does it boomerang, right? If it's not done compliantly, it could cost you money in, software. It could cost you money in fines. It could cost you money in payback. So when you think you're saving money, what area do you think you're going to save money in by getting an expert who knows what they're doing and has been successful at what they're doing to help you?
Right. And just think about this, and we've talked about this till we're blue in the face when it comes to takebacks. The thing about takebacks is, we're talking about is when you set off a claim, you get the money, and then sometime later they review it and realize, oh, we shouldn't have paid you. We're going to take it back. We'll either request you refund us directly, or we're going to take it off future claims. So you're
Ouch.
going to have to pay it back in one way or the other. But guess what? You've already done. You've already paid your staff. You've already bought that pretty new machine you wanted to buy, and you've already paid your electric bill. Like, all the things that you were counting on having money for are now decreasing in some way or another, because you had to pay it back in some way or another. So you really didn't get to keep it.
Yeah, I mean, I think that's what people who are not in finance or not in compliance don't understand. You know, no disrespect to the CFOs out there, but the
No.
CFOs, you know, they understand where the money is being invested, right? But sometimes the ROI that is not taken into account, how that affects, the investment, is bigger than a return than what they want to initially invest initially. So they don't see the balance between the return on investment versus seeking a consultant to
Mhm.
do the work, to help assist the work and to boost the revenue. But our friends at FVMA, they were all for it and they saw the return immediately. Well, not immediately,
Yeah,
but
and if you're
really.
looking, well, in a short amount of time, when you're looking for that, I mean, and CFOs, they speak that language. So for those of you who don't speak finance, return on investment, ROI, is looking at, here, I'm shelling out this much cash, this money, to this organization or to this initiative, and this is what I'm calculating. I want to see a return on that. I want to see if I'm going to make my money back and I'm going to break even, or if I'm going to have a profit, or is there going to be some benefit, right? A return to me, my organization, for that investment that we're making. And so when you hire coders, you hire a billing team, you hire a third party, whoever it is, you expect to see a return on the investment you're making, whether it's staffing or whether it's a technology like AI that you're investing in. If it's a prior authorization tool, whatever you're integrating into your software, that will cost money. And a lot of organizations, they're at this point where they're getting all this noise coming at them. Get our software, integrate with us. We have this great tool. And you might have a great tool, but that organization has to decide what the return on investment is for them, whether or not your tool is going to be a good investment for them. So that's what organizations should be doing. Don't just jump on the bandwagon and grab AI and grab these tools because everyone's doing it and they're saying they're having all these great results. Test it for yourself, yes. Do the homework, do the research, because it may not be for you.
Right. Right. I was just talking about this at RiskCon, how the OIG is now taking into effect AI and how it's affecting health risk assessments when it relates to risk adjustment. And the point of AI is to augment, right? And when you think about those third parties, when you do business to business, right? That's a term when you think about
Yeah,
third party, because you're doing business to business and you want someone to, engage in your product via contract. There has to be a return on investment, right? But there also has to be collaborative efforts, folks. Collaborative.
exactly. Transparency too. I mean, think about this for a second. And we have had this happen and it happens all the time actually, where you hire a third party organization, they're doing the billing, they're contracted, in their contract it states they're going to do this, this, and this, right? And they apparently you think they're doing it, but then you turn around and your AR is like $1 million. And you need to question, of course, where did it fall in that cog? Like, where is the gap at? Who's responsible for this? Ultimately, if you hired a third party billing company and they're not able to help you, it's either them or maybe it's the documentation. I don't know. I mean, it's something in the middle there that went wrong. But if you're not taking the responsibility to find out, then you're not doing yourself any favors. You're just letting your organization go down like the Titanic. Like that's not healthy. You have to check and make sure. And you also have to know what to look for. You got to know how to read KPIs. You got to know how to read documentation, to look at denials, and really figure out where things are going wrong because somebody is dropping the ball.
Yeah, and I want to add to that. I think it's not just about, the third party being contracted. It's more
Mm-hmm.
so about you keeping track of what you've signed for them to do. You just can't
Yes.
give it to
Oh, yeah.
them and then expect for that to be the only source and reason why your AR is going up or down. It's my personal opinion, and I'm sure Jen is on the same page, is that when you sign third parties on, you have to keep track of their progress by means of key performance indicators, knowing what they're supposed to do and what the return on investment is based upon what you're getting paid per month. Look at exactly what they are supposed to do. If they're supposed to follow up, if they are supposed to do the collections for self pay, all of that stuff makes a difference on the revenue the providers are meant to get. If they do not do that as far as what their contractual agreement is, that's not a return on investment, and that technically is a breach of contract.
Yes, and thank you and shout out to Jessica Johnson. Research the third party. She's right. There are many out there that will shy away when you ask for references because they know they don't have them. It's true.
Hmm.
Another thing, and I owned my own billing company for a few years,
Same.
and it was successful. I just got burnt out with it, and I decided I want to work on this on a different side of it. But when we were doing that, that is the thing. Like, and we had a different model and a different, I guess, a mission statement as a company, like our focus than others do. But many of them work in volume. They get paid by percentage. So they want to see the money coming in. So if you're a third party billing company and you're not seeing money coming in, you're hurting yourself. So do you understand what's happening? And so sometimes they're just trying to get things out and they think that's the goal, just to get as much charges out as possible, but they're not paying attention to payer rules. If you talk to some of them, and I have, you ask them what the policy is on this code and that code, how do they know this pays with Blue Cross? They have no idea how to find a payer policy.
Right.
And their teams are just shelling out data, but they're not reading the results of the data.
I mean, and I can't tell you how many times where I've seen where the culture is a little bit different for the billing. I'm
Mm-hmm.
just throwing it out there. where they're not stateside, so their ideas behind billing may be a little bit different than what it is in the States, and that their interpretation of contractual agreements are a little bit different. So I think
True.
it's also important for the third party to have a contributive conversation about payer contractual obligations, how
Hmm.
they plan to address them, and how it affects what they post if you're charging them or you're paying them to post, and making sure that that's done as well, because a lot of times they'll just upload the ERA and that's it, but you got all this uploaded or inflated accounts receivable because they didn't do the contractual obligations by reading the EOB. The only thing that they're doing is the ERA. That's really bad. So you really got to start thinking into consideration the components of the revenue cycle management and what you've asked them to do and how well they are doing it.
Right. And then we also have, it's a thing where you have billers over here and coders over here, like in silos, and that does happen. Our team, we always had cross training. So I had a team that was focused on billing because that was where their actual their drive was. They love billing. And the coders, I love coding. And so they did that, but they cross trained. They knew each other. If you have a billing team that doesn't have coding knowledge or doesn't communicate with the coders, they're not going to catch things. And there are really savvy billers out there that I know that I will send people to for SMEs, because they know that if they see something that looks a little weird, they're going to contact the coder and they're going to say, "Can you check this? Because I'm not quite sure." And sometimes I make mistakes. So with one of my clients, the biller will contact me and she goes, "I think this might need, fixed or added," because she knows she's not a coder, but she knows enough about billing to know something looks a little off, and I missed something because I'm imperfect, right? So these things happen. And so if you know what to look for as a biller, you need to do that. It's not just processing data. Coders and billers are not just processing data. They are doing that, yes, but they have to think analytically. They have to have a lot of moving parts. Billing's an art, as Miss Christine Hall always says. It's an art. And so
Yeah.
you don't just throw it against the wall. You're intentional with it. You know the policy, you know what will get paid and what won't. And if you know it won't get paid, have a conversation with the practice, because if they know ahead of time that there's an issue, they may make a pivot because there's a compliance issue when you bill for things that you know won't get paid, or if you should have known because it's
Mhm.
published somewhere.
Yeah. Yeah. I mean, and not only that, but think about when you're dealing with NCCI edits, right? You can't just slap a modifier in order to bypass an edit. And that's coding and billing 101. But if you don't understand the language of why it's hitting an edit, and you don't know to go to someone who understands why that edit is hitting, then you have a bigger problem because the language behind what you're billing is wrong and there's no interpreter for it.
Thank you, Jessica. I was just thinking this because this happened to me when I was taking over billing for a client, and the office manager who had just was let go recently, she was submitting the same Medicaid claim over and over and over for 6 months. And I was looking at this, and my biller I was like, "Why does the same claim have so many like rebills?" It was an issue with the wrong payer. The wrong payer was being submitted every time, because it was, we in Arkansas we have the Medicaid expansion plans that of course were popular. They're still around, but it technically was the Blue Cross version of the Obamacare plan or whatever. And she kept sending to Medicaid, even though the eligibility report clearly showed it was Blue Cross. And the patient, sometimes
Ooh.
they don't know. Like, they don't know. They hand you their cards, like, "Here you go." They have no idea what to give you sometimes, right? So it's your job to know, read the eligibility report to know who the payer is supposed to be. So again, if you see it resubmitted repetitively without knowing why it's rejecting, then you have an education issue. And if your third party billing company doesn't know these things, if this specific thing, then you have a problem. That's like 101.
Not only, I mean, and it's also really interesting how billing companies don't know how to read explanation of benefits.
Oh my goodness.
Uh-oh. I mean, the contractual obligations, the denials. If you understood how to read an explanation of benefits, you would not be sending a claim 6 times.
No.
Something would tell you to pick up the phone or do an inquiry to see what's going on with this claim and get some correspondence on what the next step is. If you're sending a claim 6 times, you have gotten an EOB 6 times, and either A, you didn't read them, or B, you didn't understand it. So, ouch.
Yeah. I mean, I was in billing before I was in coding. I know a lot about that.
Same.
I can talk about time blue in the face. I love billing and I still, love it. But we understand a corrected claim, right? When you get a denial or a reject, or you have to correct something, there's a reason, right? You actually, in the billing system, you also have to know in that billing system how they want it done because they have different workflows. So you correct it. You have either number 7 in that, the actual resubmission code or whatever number they want you to use. And then you actually have to put the actual original claim number in the note section, whatever, I forget what box it is. It's been a while since I've done it. But you have to do the original claim because that tracks for them. When they get that corrected claim, they're going to know it's a correction. If you don't do that, guess what happens? You get another denial for duplicative billing.
Yeah. Yeah. And if you talk to someone, right, and you send that claim via fax or what have you, it's the reference number that references or ties it to the claim.
Yep.
Hello. So I think, when billing companies don't understand all aspects of revenue cycle management, you have a bigger problem because they don't understand the entire process. It's like driving a car and not knowing that you need an oil change when the engine light is on. You
It's
can't,
going to stall, guys.
it's gonna stall, and if you think you're gonna go far with it, congratulations or good luck with that, whichever one. We have lovely party and gifts
Good
for
luck,
you
Charlie.
because gifts not gonna work. Got to know your vehicles, people.
Yes. And I work on the surgery side. There are definite nuances to getting surgery claims paid versus maybe like what Maya's used to with evaluation and management driven services. But one thing I ran into once was understanding prior authorizations for surgeries that use a category 3 code. So there are certain surgeries that do carry category 3 code. We know CPT says that we should not use an unlisted code if a category 3 code exists, that's in the CPT guidelines.
It is.
And so if you have a category 3 code that maybe it's investigational with some payers, that's another reason you need to know the policy. I had a situation where the prior auth team was submitting an authorization and they left off the category 3 code because they didn't know what it was. They didn't know that existed. And I was like, how do you work in billing and not know the different parts of the code sets? Because those are the codes you're submitting. Like you need to know the code book. At least understand what a category 1, category 2, and 3 are, what a HCPCS code is, Medicare driven with the G code, like all these things that like you should know. But I am still amazed that there are some even billers that don't know that. But it's training, guys. It's not their fault all the time. They just weren't given the training. And so you're welcome. We just gave you free billing training today. So again, if you want to become a certified biller, CPB, just so you know, Turner Consulting. Do you want to announce this, Maya? Do you want to tell the world what is just happening with Turner Consulting?
You put me on the spot, Jen. But I do believe
I
that
did.
she did, but that's okay because I'm really excited to announce that Turner Expert Consulting Services, my company, has been licensed to provide certified professional coding and certified professional billing education, and working in collaboration with Healthcare Inspired through MeduTrain as learning the certified professional medical auditing program. So you could get all 3
Yes.
certifications through 2 collaborative companies who work very well together. Hello, we talk to each other almost every day and talk every week here. So you're getting really great sources, information, and people that really have had a hand in the field for quite some time. So thank you.
Yes. And, I think it's really important now. And we're not saying every coder, every CPC should go right out and get a CPB. I'm not saying that. But I don't have my CPB. I'm going to get mine with Maya. I am going to take her course and I'm going to get my CPB because I'm super excited to add that to my alphabet soup. So I'm taking it upon myself to educate myself and add my 9th credential. I think I'm just going to hit 10 and be done, like an even 10. Like 10's a great number, right? So I got to get 2 more, right? Just like an even 10 and just be done. I don't know.
I don't
That's
know.
why I don't
I've
have my initials behind. Yeah.
I think
What were you
I
going to
think
say?
no, I was gonna say, Gabriel Fonte, he said getting credentials is like getting a tattoo. You get addicted to it. You don't know, like it's like,
Yes.
ooh, I want that one. Ooh, ooh, ooh. And so you get like all the excitement because you
Yes.
want to know, and you just like, oh my gosh, this is so funny. But it's very
It's
true.
true.
It's
The
very
struggle is
true.
real.
The struggle is real.
So
I
guys, I
mean,
mean, like,
yeah.
it's so real.
Yeah, I know someone
It
who has
is.
every certification under AAPC. Ava Johnson
Oh my
has every
goodness.
certification through
Wow.
A. Yeah, every
Even
certification.
specialties?
Yes. Yes.
No
Every single one.
way. That's like,
Yep.
I want to meet this person because, like, oh my goodness, that's crazy. Well, that's
Yep.
exciting. I don't have
It
all of
really is.
them. I don't intend to have all of them.
Mm-mm.
But I think that CPB is on my list, and then I want a compliance credential for sure. There's so much out there, guys. So think about it, what you want to do, because if you think about the projection of your career, CPC and CPB will always be needed because even if you don't become a quote unquote production coder, you're not doing coding every day, billers still have a need to have both, because if you can show an employer you have both, like you have done the work and you know the billing structure and the coding structure, then you got it made in the shade. Just saying.
Yeah. Yeah. I mean, and there's also a lot of certifications that AAPC offers, and there's
Yes.
the revenue cycle management specialist. There's the that's one that I have, the certified inpatient coder, and they have all of these different programs. And I think it's really important to understand that it's not going to be the amount of certifications that's going to make you a good or a great coder. What it is going to do is provide more bandwidth for you to use as a coder. Okay? Think about that. It's not about the
Mhm.
certifications, it's about the bandwidth of what you can do with it once you are trained in it. Okay? So be good at what you are for now and then build up what you are bringing on as a specialist. That's the CPMA. They're bringing a new CVBA. What is that? The CVBA. What is that? Did you see that in the
Is that
comments?
value based? Or I don't know what she means. Yeah, I don't know.
Oh,
If anyone can
value-based.
explain what the CVBA is, I personally must be in the dark because I've not heard this, but I
I
don't.
haven't
Jessica
either.
keeps her ear to the ground. I'm telling you, this girl is on it. She keeps her ear to the ground. So maybe I'm just behind and I don't know what CVBA is, but hey, if there's a new credential coming, I'm excited to talk about it. So I want to shout out to some amazing people. I think that it's really good to, tell people and, help them, help others see the potential in people. And so I want to shout out to, I think it's Tina or Tina Smith. She just got her coding job. And so she just got hired. I'm so excited. So when I see CPCAs or those that are new coders getting their first coding job, I want to celebrate it. I want to just shout out to all of those, some of the people that are in our program that are just really, really trying and doing a great job. We're going to shout out to all of them eventually in the podcast, but I want to shout out to my team, my green team. I have an amazing green team. We actually have color coded teams in our externship. So I want to shout out to Brianne Cravens, Natasha Plonk. I want to shout out to, let me see who else. We have Victoria Allen and I have Rebecca Wangler. So thank you guys for being a part of Team Green. I am so excited to be your team leader. And Maya has a great team as well. We'll shout out to her team next, Team Orange. So we're excited to hear more about how her team is doing. And stay tuned for more in July, guys. We are going to have the entire month of podcast is going to be designed around communication, because our communication training with the book Clear and Connected that I wrote last year is going to be launched full bore. So there it is. Maya's got her copy, her signed copy. This book is going to be used as a promotion and training for organizations that we are working with to add it to their compliance plan. Because in your compliance training, you have all kinds of things that you cover, right? So we are encouraging organizations to add communication training to their compliance training, because we're seeing a huge connection between a lack of communication and compliance violations.
Oh.
So we're going to be using a lot from the book in our podcast and in this training coming up that we'll have on our website. We'll have micro learning sessions you can purchase, or you can purchase the package with the book to have these trainings that you can just show to your team, or we can come on site and do it live for you. So you can let us know how you want to handle that. But stay tuned for more information on that. And next week's episode is all about the coder and the physician, that relationship.
You know,
so excited for that.
I think we also need to give a shout out to the participants in our Project Extern who we are training to be leaders. You know, we need to make sure that we understand that our program is no way in regards to parallel the Emerging Leaders Program that's sponsored by AAPC. Our program is to recognize leadership skills for people who are in the Project Extern program who demonstrate leadership ability. This is through coaching, this is through mentoring, right. And it's not any way of formatted PowerPoint slide decks or anything like that. We're just mentoring them as part of the Project Extern program to give them the momentum to take charge, because they already have that ability. I really thought that was important for us to discuss that today, because I think
absolutely.
It's really
Thank you for bringing that up, Maya.
Yeah, I think it's important that we understand that as a whole, that we don't ever want to compete with AAPC. We love AAPC. What we want to do is create
we're
more
huge
mentors.
Supporters.
Yeah, and mentors because we're leaders ourselves. We want to mentor the leaders of tomorrow. And that's all this is. We want to help them become assertive in their knowledge and be able to be that go-to person when there's a question.
Yes. And so when certain individuals did apply for the externship, which is through the AAPC's website, we signed up with Project Extern with AAPC because our organization has a huge need for help. And we wanted to also provide that ability to train the next generation of coders that are coming up. And some of them did already exhibit skills that they could actually transfer into a leadership role in an organization. So we wanted to kind of hone those skills. They are still working alongside all the externs. They are coding, they're doing the work, but they're also are used now to lead teams so that we can make sure that we have organization, obviously. Can't have the Wild West going out there. So we want to make sure that we have leadership skills that we're trying to help them develop and improve on, because they already have the experience. They're already leading teams in their jobs. We're just helping them hone those skills and helping them see where they can, of course, reach. For the sky's the limit for everybody, but anyone can be a leader, right? Because you don't have to be a manager to be a leader, but that is a skill that is really needed in the organizations today. So we applaud everyone who, in their own right, in their own organizations, wherever you are, has leadership programs. Everybody should have leadership programs because they are so valuable to the organization. So thank you again for tuning in to this episode of the Practice Perfect podcast. We will see you next week, guys, where we will talk all about the physician and the coder relationship. See you soon.